morning, Singapore. Welcome to the big show. All right, today is Therapy Tuesday. It is also International Armpit Day, everybody.
I know.
No!
That was the first thing. He put up his arms like that, and I went, maybe not. Put it down. Put it down.
I'm kidding.
Please, we need to ban singlets from the studio.
Why?
No,
Okay,
singlets.
let me
I
just
love
justify.
arms.
Okay, the only reason why I'm wearing a singlet today is because it is our big shoot today.
That's got nothing to do
We've got
with
a
our
photo
shoot.
shoot.
Why?
So
Why?
it's just tradition for me.
It's tradition.
Yes.
Yeah.
So, I'm already being really good today because I'm wearing my jeans. Whenever we have a photo shoot over the
You
years,
don't wear your jeans.
I come in with a tank top and shorts.
Which makes
And
sense.
of course,
Yeah.
Your Birkenstocks. Oh my goodness. This is
Yeah.
like
And of course-
a fashion tragedy.
it is.
Tragedy.
It
It's
is.
a travesty as
Because
well.
once I go
Very
into the
90s.
studio, it's like boom. You know, like the fashion
it all
models.
off,
You know,
right?
you just
Okay.
Yeah.
change out to like the next
True.
5 outfits.
So you've
and-
just compared yourself with the fashion models.
I mean, once
On
one time
par.
I was kind of a supermodel.
You are
once
still.
upon a
You are
time.
still
Oh,
supreme leader.
Shaun.
Stop it,
Twice.
Sean. Stop it.
Very
Stop
handsome.
it.
Very good. Look at his arms. Look at the definition.
But
there,
look at
there.
his armpits. That's more interesting.
Nice also.
Yeah, but
Nice
speaking
armpits.
of real models,
It's
and
terrible. Look
good-looking-
at Jerry's face. You see, I think Jerry's like me. There's something about a man's armpits which should never see the light of day.
That's true. But you see,
It should just be kept under.
But-
Am I right? Yeah, there
but
you
you
go.
see,
There
when,
you go.
when you're well groomed and there's
no,
Nothing,
please.
yeah.
then
Look at
it's
that.
fine. You know, but
Looks like
it's
an Axe body spray commercial.
like a huge bush
You mean
under the armpits.
you mean
then-
an X body spray commercial, not Axe.
Okay. But anyway, I was telling Jerry, right? I mean, Jerry, tomorrow there's a very good-looking guy. Speaking of models and all that.
Oh,
you know.
yes.
Jason Godfrey is going to be on the show tomorrow, ladies and gentlemen.
That's
so tune in
right.
tomorrow at around this time. But today it's all about Jerry from the therapy room. Dr. Geraldine Tan, good morning.
Morning, and it's not about me. It's about depression.
Oh my
No.
God. Are we talking
No,
depression?
but
this
but
morning?
it's very interesting because we're talking about high functioning depression. So
What
I
is high
thought
function-
depression was depression,
right?
No,
Yeah.
there's low functioning depression and high functioning depression,
And
right?
No,
We're just making this up as we go along. Jerry,
I
okay,
think
please enlighten us.
Yeah, so high functioning depression was actually, kind of spoken about, and a lot of people, and I decided to talk about it because, a lot of people were talking about high functioning depression. And I was like, why you all keep on going on about it, on and on. And last week itself, I had at least one every day. So I work, say, 6 days, and I had one every day telling me that, Jerry, I have high functioning. I'm very high functioning. And I was trying to figure out, like, I don't think high functioning depression is a diagnosis. And it's not. It's not a diagnosis. But what they're trying to refer to is that they can function despite depression. So we had spoken about depression before.
Yeah.
And depression, we kind of drew it out, like many of them are quite beaten by the whole disorder. They are on their beds, they're very lethargic, they can't do anything, they're on a cocktail of medication, low energy, and that whole depressiveness, which is rather severe. So this group of people feel very stuck. They go, but I can't go to work, and I want to go to work. I just feel extremely stretched, or very helpless when I go there, because I have the weight of the depression on me. But no one seems to understand. So they keep saying, I'm a high functioning depressive person. So it's very interesting because they're struggling so much. And one of the clients was saying, please, Jerry, talk about this on air. So I took up the challenge and I said, okay, I'll talk about it.
Yeah, because many a time, I mean, we don't know what goes through the minds of people who suffer from depression.
Depression, yeah.
I mean, for most of us who are blessed enough, not to be in that position,
It's interesting that Jerry's bringing this up today because it was towards the end of last week that I met a friend of mine I hadn't seen, an acquaintance of mine I hadn't seen in like 3 years. And we got to talking. And he's been suffering from depression for the last 2 years. And talking to him, until he brought up the subject, I would never have said he was a depressed person. He doesn't, he seems so normal.
Yeah.
You know?
And they're very hard to pick out, you see, unless they actually tell you about their diagnosis. But I think most of them would have what we call dysthymia, this mild chronic depression that goes on and on and on. Dysthymia. So dysthymia is, I think, is under now the classification of pervasive depressive disorder (PDD).
Okay, hold on,
And-
Jerry. We'll explain
Okay.
this what again?
Dysthymia.
Dysthymia. Live on Facebook. We are live on the Big Show Facebook page as well as the 1FM 91.3 Facebook page. Here's Dr. Alban. It's My Life on 1FM 91.3. You're listening to The Big Show. Dysthymia.
Yeah,
So,
Jerry,
at dysthymia on the show, we need to.
So, Jerry, I just have a question. When you say high functioning depression, that is not an official term. It is just
No.
a term of people who are depressed but can still carry on with their lives.
Yes, so they
Right.
call
Function.
themselves high functioning.
Okay, so it's
Yeah.
not an official term.
No, it's not a diagnosis.
Okay,
But
okay.
whether it's official or not, they feel that it is official, but it's not a clinical diagnosis.
Okay, fair enough. Okay. And you were going to talk about dysthymia?
Yeah, because I was saying that these people with who say that they have high functioning depression, most of the time have chronic depression or dysthymia. So they don't have the major symptoms, or very severe symptoms or very intense symptoms. They have that low grade sort of, like when we have low grade fever and we
Yeah.
don't feel too good. So they have that low grade of depression that kind of weighs on them. They can't seem to get it off. And usually it lasts for years. It doesn't come off. Yeah. So, and the chronic depression, it can fade for a short time and then it comes back again. So chronic depression dysthymia is parked under PDD, a persistent depressive disorder.
Wow.
And these are clinical diagnoses.
This is so, because everything stems from
Your mind.
Yeah, from
Yeah.
your mind. So it's
Yeah.
the psychology, right?
Yeah.
And it just affects your entire being.
I mean, it's scary to know that there are depressive people around us and we may not even know it.
Yeah.
Are there signs or any
I was about to
symptoms
say, yeah.
that we can look out for to know that someone is depressed and perhaps help them?
There are the usual signs and symptoms. So you would see like them being in a depressed mood, like, the whole day they're a little bit down, they're very heavy in their moods. You ask them to go to the different like activities or hang out with people or eat with you, they would generally reject you. And you go like, hey, don't be a small sport or don't be a wet blanket. So they would typically be called those names, but they would not tell you why they don't want to go for such events. They will complain, oh, I'm very tired. Every day they seem to be extremely exhausted. Sleep sometimes can be too much or too little, also depending. That changes in their appetite, changes in their weight. So very similar to the major depressive episodes also, right? Very negative sort of thinking. So they would not be so extreme, yet their words, how they present themselves, will be kind of peppered with a lot of negativity.
Okay, hold on, Jerry. I'm going back on. Leave it. We've got Dr. Geraldine Tan from the therapy room with us because it's Therapy Tuesday. Jerry, so what advice would you have for people who are feeling depressed right now?
who are feeling depressed.
Yes, as you mentioned, some people may have low-grade depression, and have not perhaps maybe asked anyone for help, or may not know what to do. So for people who are listening to us right now and who fit that category you just mentioned, what advice do you have for them?
Actually, there's another category of people which then quite a number of people might resonate with that. It's called the smiling depression.
Oh, wow. Okay.
Smiling depression.
Smiling
Wow.
depression.
Smiling depression, again, not a clinical diagnosis, but these are even harder to kind of pick out because they don't, in front of you, they don't cry. Okay, so they're not the weepy type, and they just mask it. So you look at them and they seem to be able to do a lot of things, and they just mask it with a smile.
Yeah, but maybe the smile is a bit unnatural. Like this,
Well,
like,
but there are a lot of stories that you hear about people who have, I know it's a terrible thing to say, taken their own lives and stuff like that. And then you kind of ask yourself, but they look so happy.
Yeah.
There were no signs. So
Yes.
these are the smiling depressives that you're speaking of.
Correct. So they are high functioning, they can do their work, but they just smile and they hide it. So
Okay. Carry on.
for those that, and I'll answer Glenn's question now, for those that are trying to hide it, figure out why you're trying to hide that depression. Whether you find it embarrassing, I'm such a high achiever, and many of them are really high achievers, so they look at themselves and go, but I'm such a high achiever, I feel embarrassed if I have a depressive disorder. Or they feel that they burden other people. Kind of, many of them would say, but everybody have their own problems. I don't want to put mine onto them. So they kind of downplay their issues and not want to showcase their issues to anyone. If you are a perfectionist, so this is good. And yet, for smiling depressives, or high functioning depressive people can be quite bad because they are so particular about being perfect. They do not want to appear weak.
So you're saying overachievers, perfectionists, those are often the people, or not always obviously, that are depressed because they can't seem to meet their own expectations. Is that what causes it?
I don't think it is, because there are many perfectionists and many people that are very high achievers that don't have depression. So I think what kind of hides it, or what makes them hide it, is probably because of these. So when they have the depression already, they hide it because they have these at the back of their minds.
It's interesting, Jerry, because earlier you were talking about sluggishness and being slow and being negative and blah, 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 and yet they're high achievers. These people live in a constant world of conflict.
Conflict, yeah.
Yes.
So it's
Yes.
internal conflict, isn't it? Among like demons within that keep fighting against each other.
Yes, so they're very angry, they're very frustrated. So that's why they have that feeling of helplessness and hopelessness, because they can't break out of it. And they're very scared because they have achieved so much. They're very scared to let the workplace know, because they don't want it to be perceived as not good anymore,
Right.
or the repercussions on their work. They're very scared about that.
Yeah, I think these people constantly analyze things. They're thinking a lot.
Overthinking
Yeah,
things.
they're overthinking everything, and so they're always in conflict. With the things they have to do. They're questioning why.
But is
and
that
so
a
on and so forth.
majority, Jerry? Is that a majority, or is that a stereotype?
The overthinking, well, many of them do think
Okay.
a lot. So they analyze a lot because they are achievers. They have to get to wherever they get to with a lot of cognitive work. So yeah, that is sometimes part of their job even.
Yeah. See, sometimes it's better to be a simpleton.
I think so. I think so. When we come back, Hillary David on our Facebook page has got a couple of questions for Jerry.
All right. Meantime, here's Alanis Morissette, Hand in My Pocket on 1FM's Big Show. Glenn Angel, FD and Shaun, and Jerry.
So, Jerry, Hillary has brought up two different things. Deal with them one by one.
Yes.
First of all, do these people have a need for isolation? They are comfortable when they are isolated from everybody else.
Very good question. So many of them isolate themselves because they think people don't want to know about their problems. They think that they should keep it to themselves. They feel guilty, like, they think of things like, my life is actually really good if I look at it, and why they feel guilty for feeling depressed or having depression. So they isolate themselves even more. When they don't want to burden other people, they also then isolate themselves. But no, they don't want a whole troop to come to them, but they would appreciate one-on-one care. That would, small groups, one-on-one sort of attention can really help them.
Do people also tend to not self-diagnose themselves as depressives? Because, people will be like, no, I'm not depressed, but they actually are. That's the first step to knowing, right?
Yes. So denial is another one. Angel, you read my notes, right?
Yes, I got Shaun to go into
What
your office
notes?
and disturb your interns that you have there. Rachel and Arissa.
Clarissa, yeah.
Carissa, yeah.
Carissa, yes.
Yes. So denial is one. Sometimes they find it hard to accept that they have a disorder. So they kind of push it away and deny it. And it just kind of, because they're so high achieving, so functional, they kind of delay treatment or seeking help for a few years. So yesterday I had one that came and she delayed it for like 4 years.
Wow.
I don't know how she managed.
Yeah.
Yeah.
So what does it take? What does it take for one who is depressed to finally admit that they're depressed?
I think when they cannot bear with it anymore, when the weight gets too much, that's one. The second one is when they start having more suicidal thoughts, because these depressive people do have suicidal thoughts, and they start acting on it, or they start getting closer to acting on it, and it scares them.
Oh, that's interesting, because that's another question that Hillary had. Do these people have thoughts of death but do not act on it? But you're saying they do come close to acting on it.
Yes. So they have those thoughts like, what's the point of all these? I just feel so horrible, death can end it all. So they have these ruminations. They're such intellectual beings that they know it's not rational.
Yep.
So for many, many years, they would just manage it. But when they start feeling worse and worse, they might start to stand at the window. So there was one that, stood at the window, caught herself, and went, oh my God, what am I doing? And then that brought her to therapy.
Oh wow!
You know, yeah.
But for some, it's a little too late, right? Before they can even make that thought. But that wasn't my question. My question is there a certain age group that you see of people that are depressed?
Oh, so there is. So the smiling depression often, we have the teenagers coming. So they put on a show in school, rah rah rah. So oftentimes I see many of them. Big bulk of them. The high functioning one are our working adults, our 20s, 30s, 40s population. Yeah, who are at work, they have responsibilities already, whether to the family or to their work, and they find it very, very hard to extricate themselves because their depression is not severe enough to just beat them down and just leave them on the beds.
Yeah. Would you say, people who suffer from severe depression, right? They don't look forward to to going to work the next day, or they just lose their enthusiasm for life in general.
Yep. So it has to be
That is
pervasive.
so hard.
So it has to be pervasive. So not only for the work, it can be going out with friends, it can be doing things that they like, and they lose that motivation to do that.
Right. So isolating themselves certainly does not help, right?
No. But they don't need a lot of noise either.
Jerry, Joel has a very honest question, and I'm sure a lot of people would want to hear your answer to this.
As opposed to the other person with the dishonest question.
No, this is very serious. Joel says, please help me understand. Is there a way to tell the difference between having self-pity and having depression?
That's interesting.
Okay, so as a clinician, we often, find it very difficult to even explain it to the ones that come in with that low-grade depressiveness. They would often say, yeah, but my life is really good, compared to people, in the third world countries. There must be many people that are suffering out there that are in a worse position than me. Who am I? So when we hear them say that, we understand that they are struggling from within, okay? As opposed to someone that goes, my life is horrible, it's so terrible, why is life treating me like that? And they are lamenting about how the world is just trying to crush them, and they're not fighting it at all. They're like, oh, come take me, and allowing, whatever that to hit them without putting up a fight.
That's self-pity, right? That's self-pity.
Yeah.
Okay.
Yep. So they play the victim role. The depressive person typically doesn't want to play the pity role or the victim card. Sorry, doesn't want to play the victim card. But sometimes it does feel so dreary that they verbalize all that negativity, which is different.
So there's nothing wrong with the person up there when it comes to self-pity, right? That person is just being there.
Being what? What is that word?
Just like manja.
Manja, very manja.
Manja, I understand. The other one I
You
can't
know.
even spell.
It's a sound effect.
So yeah, I mean, self-pity, pya, wake up.
Yeah, I have no time for people with self-pity, honestly. But I think they need some love.
Yeah.
They do.
Yeah, they do.
They need some
Right.
love, yes, but I
Yeah.
think
Because
it's
they're not depressive, you see.
no,
not.
yeah, it's
They're
not.
not.
It's
Yeah.
it's not a condition where they need help. They just need someone to come along, as you said, slap them over
Like
the head.
FD sometimes.
Yeah,
So-
sometimes smack
you
him
know,
over the head.
This whole
and-
self-pity thing. When Liverpool loses, he's like, there's some self-pity there. When Liverpool loses.
More like you. But Jerry, can that self-pity ever lead to depression?
It may. I mean, if your narratives are so negative,
That
why
it
are you
automatically
treating me
goes
like
that way.
that?
Yeah. That it automatically goes that way.
Yeah. It becomes very negative and dreary and dark. It can. I think we want to jolt them a little bit before it goes into a clinical disorder, or maybe they are predisposed to having depression. Then yes, they go down the slide quite fast.
What can we do, Jerry, as people, if we're in a household or in a community where we know someone who is depressive?
So I've got, again, it's Jerry's words, okay? Cannot Google it. But I've got acronym called DEAL. So deal with it. DEAL. So deliver what you preach, because a lot of times we say we understand, we know what depression is, but we don't deliver what we actually tell the professionals we want to, because they will agree everything in here, go back and do a different thing. So that's the family members and people in the community. So they just pay lip service that okay, I know what depression is, I know what to do with it. So please deliver. Okay. Second one is acknowledge. So in order to deliver, you need to acknowledge the disorder, you need to acknowledge that the other person has an issue. Then we embrace it.
Okay, hold on, Jerry.
91.3 traffic.
Alrighty, we've got the usual delays across the expressways. We know that for sure. KJE towards the BKE, vehicle broken down after Woodlands Road exit. We also have PIE towards Tuas, an accident after Bedok North Road. Look out for that. Newbridge Road towards Teo Hong Road, roadworks after Pearls Hill Terrace. PIE towards Changi, vehicle broken down before Pasir Laba. Stay within the speed limit. Have everyone buckled up. Make sure you drive safely today, please.
Good morning and welcome to The Big Show. Glenn, Angel, FD and Shaun, and our special guest today, of course, because it's Therapy Tuesday, is Dr. Geraldine Tan from the Therapy Room, helping so many people on a daily basis. Bless you, Jerry.
I'm just borrowing your mics, you know.
No, absolutely not.
No. Jerry.
Yeah, can I have self-pity?
No, hey,
That's self-pity right there.
Jerry, I asked the question, how can we help people within our family or the community who have depression? And you said you deal with it using just
Deal.
that, deal. So D is deliver what you preach.
Mm-hmm.
Can you continue?
And A is acknowledging that there is a disorder in the person.
What about
Then
E?
Yeah, I know.
E, embrace.
Okay.
Embrace.
She haven't finished
them.
A, you asked her for E.
Yeah,
This is E
embrace
first,
them
then
in
A.
a,
Yes, correct.
Sorry, okay, sorry about that. Because I'm trying to, just
Spell it.
point
You're
that out
trying
to
to
the
spell it.
dyslexic guy over here. Yeah. Okay. Yeah. Anyway. Yeah. Go on. Sorry. Embrace. Yes. Embrace. And
embrace. I embrace all of you. We include all of you. No, embrace meaning to give them that safe environment, because if you heard us earlier, it was that they feel the environment is very unwelcoming. So we want to give them that inclusiveness, that safe environment to express themselves. And when they do express themselves, then it brings us to L. Listen to them. Listen.
I
Yeah.
forgot what's A again.
Acknowledge.
Knowledge.
So it's DEAL. So deliver, practice what you preach. E being embrace.
Embrace.
A being
Acknowledge.
acknowledge and listen.
Nice.
Yeah,
Nice,
I
I
think
like
that's a
that.
good acronym to have.
Very nice.
Very good.
Okay.
Yes.
Any more questions?
Anything else from Facebook?
I'm
FD?
about to go back to
Dr. Jerry, I
Facebook
just
to
wanted to ask
benefits.
about, just now when you mentioned smiling depressives, right? What's the difference, or is there a difference between that and using humor as a deflecting mechanism?
Well, I think we all have seen that image of the clown taking down his makeup, and inside is a very sad person, right? So humor is, I mean, the comedians, let's go with the comedians. These are very creative, intellectual people, and they can be very balanced also. So when we say smiling depression, it's more these people who try to smile and brave the storm of the day and go about their day. Yeah, it's so they don't showcase to people. So if, let's say, your humor hides your dark emotions, then there is a problem. But if your humor is born out of creativity, so some people can be quite punny. They come up with lots and lots of puns. And that's fine.
Yeah. I think research was done a few years ago, regarding stand-up comedians, and they found that 70% of stand-up comedians are
Depressed.
actually suffering from depression.
Yes.
Depressives,
not
yes.
surprised.
Yeah.
It has always been said that you judge a truly great comedian by his private life.
Yes.
If his private life is quiet, very, very
Secluded,
sober, very
yeah.
secluded, you'll find that he is a great comedian.
Yeah, yeah.
Yeah, very true. Very
I suppose because it's very difficult to constantly be funny. Because people are expecting you to constantly have a joke up your sleeve or be witty, and it's very tiring and it's emotionally draining. So the complete opposite would be to be a recluse and just hide in your little cave on your own and just be quiet.
Shaun, how many of your friends, because you've got so many
A lot
stand-up
of them, yeah.
comedian friends, right?
Mm-hmm.
Are they
a
are
lot
they
of them,
depressives?
A lot of them are depressives, as we talked about today, high functioning ones. Some of them, they can still function, they're normal, go about their day. Some of them are very loners, recluse, and stuff like that. But it also helps to understand that a lot of comedy is birthed from tragedy. So a lot of them
That's
go
true,
through a
yeah.
lot of tragic, and they have a lot of
Right.
micro traumas in their life as well.
Wow.
So because of that, and with time, that's where they get their material from.
Right.
Talk about their life and
Very
stuff, and finally reaches a stage where they can, have open therapy on the mic and then just share about, okay, this is what I went through, blah 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 blah,
Right.
and with a
Yes.
punchline. And that's
Because
like
a perfect life is not funny, right? It
It's
needs to
not.
be like tragic and painful and
So
something needs
does
to
it mean
happen.
they're trying to heal themselves when they should be seeing someone like Dr. Geraldine Tan?
A lot of them go to therapy. A lot of them
Okay.
have
I see.
people that they see as well.
Jerry,
Okay.
do you see many stand-up comedians?
It's a new
No,
market I can
I-
open for you. It's a new market I can introduce
No,
you to.
she
Yes.
doesn't, Glenn. She's got you and Sean every week.
That's more than enough. It's all the comedy you need.
Yeah, but it is true because many of them, in order to do that stand-up comedy and to tell all that with such high energy, they need a lot from themselves.
Yeah.
So by the end of it, they can be quite tired. So reclusing actually gives them the balance to
To
recharge
recover and
themselves.
recharge, yeah.
Yeah, yeah.
Jerry, I've got one other question from our Facebook page that I think is really interesting. It's from Tiki Chua. He says, as a psychologist, you obviously don't suffer from depression. He's wondering, how do you understand, how do you put yourself in the shoes of that depressive person to help them?
So a lot of people love to make statements like that. And first of all, when people go to the psychologist, they don't know about the psychologist's private life, correct?
Correct.
Yeah, so we cannot judge. So there are colleagues out there who may be suicide survivors, may have depression, and may have different sort of issues also. So just putting it out there. Understanding depression doesn't mean that we have to be depressive ourselves. So yes, we can form a support group with a recovering drug addict, but the therapist does not have to be a drug addict themselves, right? So it is good to have a bit more experience with the issue itself, but it doesn't mean that we need to go through that to be an effective therapist.
Right.
Okay.
Yeah.
Right. All you need, understanding and love.
Compassion,
Yes,
yeah.
compassion.
I think compassion,
True.
empathy, and a huge heart. Not everyone can be a therapist.
That is true.
No, with a huge stomach. We eat a lot. We cope by eating a
oh,
lot.
really? Wow, that's your coping mechanism. We need to send
Oh,
you
just-
food.
She makes her
My
food.
office is full of food.
No wonder Sean is there all the time.
Bringing back snacks for you guys.
Oh,
I
great.
haven't seen. I only saw once.
Yeah, one
There's
time.
more.
We still have the
Don't you
have
tarts.
the tarts?
Yeah,
We
you
still
haven't
have the
finished this one.
All right, up next, Major. Here's Breathe on 1FM 91.3's Big Show.
And we're back.
Are they still taking orders, Jerry, for the tarts?
I'm not sure, but it's all year round, so
Oh,
these
right.
ladies make really nice a big bakeware, like they have lovely cookies.
Yeah.
So you can order all year round.
Yummy.
Some of these ladies make really yummy food, like the nasi, some rice
Nasi
thing,
padang.
Maybe you can ask them. Yeah.
So this person's name is Stella. For those of you who want to try and order the tarts, you see, the only reason there are still tarts in here is because we've got the big photo shoot today.
Yes,
you see?
yes.
Yeah.
After today, oh. So
God.
Stella, that's STELLA at beyond.org.sg. Yeah.
Okay. And it's not just tarts, they have everything else. But since
Yeah.
Chinese New Year is next week,
Yes.
get your pineapple tarts.
Baker's Beyond.
Jerry, there are a couple of comments on our Facebook page that we really don't have time to deal with today. So if you could get someone
No
from the
worries.
therapy room to hit our Facebook page and perhaps answer some of these questions, it would be really good. It would help our listeners a great
Yeah, put it
deal.
in the
I
chat.
would. Yes,
Yeah.
I would. Yes.
Thanks, Jerry.
Fantastic.
We haven't had topics that spark such excitement for a while, so
Yeah, very true, very true.
I'll be happy. But maybe what I'll end with is actually something that this client of mine said, okay, can you just let everybody know? And I'll probably just end with that. And she says that high functioning people struggle a lot. So this high functioning people with depression struggle a lot, and they have a very huge sense of responsibility, and they have that dilemma whether to go to work or not. So they don't deliberately want to take MC because they struggle with that dilemma, and because of the depression, they have to work harder than anyone else, leaving them tired at the end of the day. So she made a quiet appeal for employers to be a bit more understanding and for colleagues to be a bit more understanding.
I can't imagine. It must be very, very tiring because being
Yeah.
depressed alone is emotionally draining. And then to have to deal with everything else like work and family and
Yeah.
work-life balance and children and
Yeah.
spouses and all that. It
Yeah.
must be it must be so tiring.
Yeah, and you don't want to go out there and announce it to the world.
No,
you know,
no.
so,
You want everyone to think that you can handle it.
yeah.
You know?
So I think today everyone should just
Chill.
just remind
Chill.
themselves that,
Yeah.
that when you bump into other people, when you
Yeah.
encounter other people, just remember that people might be going through certain things in
Be
life.
mindful. Be mindful. Yeah.
And so let's all be nice to each other and be respectful. If someone is rude to you, I'm not saying it's justified, but that person might be having
It's
a
coming
bad
from
day.
somewhere.
Might be
Yeah.
might be going through a really hard time. So yeah.
Don't ever judge. There you go. Go through your day without judgment. That's the first step.
All right.
Jerry, thank you so much. Again,
No.
as always, you've been helpful to all of us. You've been helpful to our listeners and our viewers as well. Awesome having you on the show.
Love being on the show. I'm going to see all of you next week again. Enjoy your photo shoot and then enjoy the pineapple tart.
Oh, no.
Yes! Thank you.
Yay! Big heart. Big
big
heart. Big heart. Thank you, Jerry.
Bye, Jerry.
Bye, Jerry.
Bye.